Hi everyone, my name is Kaylee Marston. I'm a speech language pathologist in the Department of Supportive Oncology here at Levine Cancer Institute. Today, in honor of Aphasia Awareness Month, I wanted to talk a little bit about what aphasia is, some symptoms, and treatments. So what is aphasia? Aphasia is a language impairment that's due to some type of damage in the brain. So this can impact things like verbal expression, comprehension, reading, writing. Like most things, it's kind of a spectrum. So individuals can have aphasia on a more mild scale all the way to severe or profound. You can have deficits just in one area or multiple areas. Many people may have more significant deficits in one area, such as, verbal expression, whereas their comprehension is mostly intact or maybe mildly impaired. And so it can be a real variation patient to patient. But if we think about how important our communication is for day-to-day life, this of course really affects an individual's ability to communicate their needs, their wants, which affects things like independence, quality of life, and can put a lot of burden on a caregiver. So let's look at some facts about aphasia. The most common cause of aphasia is a stroke. Head injury can also result in aphasia, as well as brain tumors. And in somewhat more rare cases, an individual can develop aphasia from a neurodegenerative disease. That can include things like primary progressive aphasia, which is a kind of frontotemporal dementia. And in that case, like the name says, it is going to progress and worsen as time goes on. But overall, aphasia is said to affect about 2 million Americans, which is more common than many kind of more well-known diseases such as Parkinson's or cerebral palsy. And it's quite interesting that a lot of people don't really understand aphasia unless they've been around it, yet it is quite common overall. And like we talked a little bit about, there are different types, and some of those types can be named based on the area of the brain affected. So you have things like Broca's aphasia, Wernicke's aphasia, and again, there can be mixed types or global aphasias where you have deficits kind of in all areas more severely. And I found this kind of statistic interesting that, a survey done back in 2016, 84% of people had never even really heard of aphasia, which doesn't surprise me based on my experience, but I do find passion in just making individuals more aware, not just those that are affected by aphasia, but I think the more that all of us can understand it, that way when we come into contact with someone who demonstrates some of these difficulties communicating, maybe we can be, more understanding. So now let's talk a little bit about how aphasia kind of comes up in oncology, since we are here at Levine Cancer Institute. So most of the time, aphasia can occur in individuals who unfortunately have brain tumors or lesions of the brain, such as brain mets, particularly in areas of the brain that are responsible for things like verbal expression, comprehension, reading, and writing. And that is why the location is relevant. Those that have tumors in the left hemisphere of their brain most of the time are those that will have, unfortunately will have impairments such as aphasia. That doesn't mean that everyone who has a tumor in their left hemisphere will develop this. It's just that is kind of the most common area and cause. So then in many cases, individuals with brain tumors may have to undergo surgery or resection of that area. And so post-operatively, that's where the aphasia may be more significant even, because they've now kind of removed a, part of the brain, and that's kind of considered, damaging, of course, to the brain. And in maybe less common situations, unfortunately, sometimes treatments like radiation or things that people may have to undergo in oncology can cause a stroke. And so, like we talked about in some of the stats previously, individuals who have a stroke, it's very common to have aphasia as a result. So in that case, it may also be present. And as I've stated already a couple times, the severity of someone's aphasia and their prognosis, meaning, if the aphasia is going to improve versus if it's going to worsen, that kind of thing can, of course, greatly vary across cancer patients because it's going to depend on the size, such as like the size of the tumor. It's going to depend on the location in the brain. It's going to depend on what other treatments they may have to undergo, if they have progression of disease. So it can be kind of ever changing, ever evolving, and just quite variable. So what are some aphasia symptoms? Again, there's lots, but I'm going to talk about a few of the key ones. A lot of people will describe kind of the more obvious or common types of aphasia as difficulty with word finding. So that can mean kind of that experience that we all sometimes have where we know what we want to say and it feels like it's on the tip of our tongue, but we can't quite sort of grab that word from our brain and use it within, a sentence or conversation. But in aphasia, this can happen a lot more frequently. So people can have difficulty, naming things in their environment, difficulty pulling words forward during a conversation. As a result, they may make a lot of sort of errors where their brain may substitute words that sound similar, such as, pup for cup or something, or a word that means something similar. So maybe saying pencil for pen. So there can be a lot of those types of errors. Sometimes in other cases, the brain may even produce a word that doesn't exist, kind of a non-real word. It sounds like language, but it's not actually a real word. It may even have some similar sounds to whatever their target word is. And in other types of aphasia where maybe comprehension is more affected, someone could speak perfectly fluently, but the strings of words together or their sentences don't quite make sense, meaning you can't quite follow what they're trying to say. And in that case, oftentimes their comprehension is more impaired. So during conversation, they might have a hard time kind of understanding what's being talked about, answering questions, following directions. And then there can be changes to reading or writing or both. Sometimes even math can be affected as well. But in changes with reading or writing, that could look like having difficulty specifically spelling in terms of writing, or in reading, making, missing words or kind of changing words. Again, they may substitute it for something that sounds similar but's not quite right. So again, a lot of different variations, but it's going to affect communication. Something I'm constantly stressing to patients as well as their caregivers is that while it can be obviously extremely frustrating and feel like you've lost a lot of your knowledge because you can't, let's say, recall certain words, aphasia does not impact intelligence. It is not a sign of intelligence one way or another. And it's not that you've really lost the words, but rather the pathways in your brain to kind of retrieve them, or the connection to, understanding language is affected, kind of that network, that pathway. But it is not the same thing as intelligence by any means. And a little bit, in kind of expanding on that, I like to use the iceberg analogy. The iceberg analogy is used, especially in healthcare, quite a bit for a lot of different reasons. But for aphasia, what I really like to point out to people is that some of these deficits or challenges I'm describing, like having difficulty finding your words, grammar errors, problems reading or writing, problems following a conversation, someone you see who has a lot of pauses in their speech, or their speech sounds very like halting, or you can't quite follow what they're saying. That's what you can see or hear. That's what's on the surface. That's like what the symptoms are of aphasia. But what's harder for people to see and understand is that what's going on below the surface is that when we have a hard time communicating, and particularly in individuals where communication wasn't a problem before, and suddenly this is such a big change, that this often leads to, feelings of frustration, hopelessness, a lot of anxiety around communication. People tend to start to really isolate themselves or avoid situations where they're going to have to talk. They start to slowly maybe lose some of their identity, especially if it affects their work or their role as a parent, or their role in the community, their role in the family. So it can be sudden, but it also can be some gradual things that are harder to see or pinpoint. And these things are really, really, really impactful to someone's overall quality of life, of course. So some of that hidden and often internal struggle that a person experiences that has aphasia, again, is not always visible. It lies below the surface. So we, as therapists, have to really consider the whole person, both above and below the surface, and it's important that families understand that, community members understand that, medical providers understand that, and again, sort of address whole person. So in terms of treatment, it's very common for individuals who are experiencing aphasia to come to speech therapy. Sometimes speech therapy is done while someone is in the hospital, while someone is in inpatient rehab, at home, or like I do in kind of that outpatient therapy setting. And treatment really should focus again on kind of everything, but in terms of improving independence, maybe quality of life, we do a lot of caregiver training and education as well, really focusing on someone's ability to participate in their life. That means participate in conversation, maybe participate if they're still working, participate in their medical care. It doesn't always mean that we are going to be able to completely recover all of their language, because, for instance, like I talked about in the cancer setting, there's definitely times where the aphasia is going to progress or be very variable. So we really want to make sure that we train patients to kind of have and use compensatory strategies, so things that will help them kind of compensate for or make up for some of these deficits, so that they can still communicate effectively, even if it's not perfect. Sometimes it can involve training in what's called AAC, which is alternative and augmentative communication. That's often uses technology. Sometimes that can be something like a device, but it also can sometimes just be even low tech would be little communication boards or a little wallet card that has some script on there that kind of talks about the fact that they have aphasia and that sometimes they have difficulties, and things that you can do to help support that person. So we provide also a lot of resources and education around what aphasia is, support groups, because like we talked about, we have to make sure to really address the things below the iceberg, under the water as well. I'm lucky here at Levine Cancer Institute to work really closely with music therapists. So that's often an avenue that we will explore, because, music uses sort of whole brain and can often help to access kind of language in a different way. And again, we just need to make sure we're making it patient-centered and that it's meaningful goals, that we're working on, actual things that the patient wants to do. So if you are a caregiver or someone that is close to an individual that is experiencing aphasia, I always like to kind of talk a little bit about some things you should do versus don't do. And these are very tangible kind of strategies or just things to be aware of that you can put in place right away. You want to always make sure to speak to them like a competent person. That may sound really obvious, but sometimes when patients or individuals have difficulty communicating, others can talk to them kind of in baby talk or childish language, and that's not helpful. So we want to make sure we're always speaking to them like they are a competent, individual that still has a lot of intelligence. It can be helpful though to ask one question at a time or to kind of chunk what you're saying. So if you talk on and on and on for 10-20 minutes, it's going to be a lot harder for that individual to follow if you're not taking breaks and kind of checking in with them. Sometimes yes/no questions can be helpful as well if someone's really having a hard time. I think being aware of your body language, like making sure you're making eye contact, you're not looking kind of like, what? I'm so confused, or you're turning your back to them, or you start doing something else because they're taking a little bit longer to find their words. All those things will make it usually much harder for the individual with aphasia to communicate with you. You can offer to fill in a word when the person's stuck or maybe guess what they're trying to say. But I always encourage people to make sure that that's okay with the individual who has aphasia. Some don't mind at all. Others find it extremely, frustrating because they just need some extra time. So don't kind of speak for them without their permission or just assume that they want you to be guessing the whole time. Sometimes you need to just be patient and take a pause and wait. Allow for the individual with aphasia to use anything that will help communication, whether that's gestures, pictures, like technology. We really want to use kind of all forms of communication in order to get our message across and not only get stuck on what they're able to verbally say. So allowing multiple forms of communication can be very helpful. So, in summary, aphasia is a language impairment, causes difficulty with talking, understanding, reading, and writing. And again, since the focus is cancer, aphasia can occur in cancer because of damage to the brain, often from brain tumors, but also can be from things like radiation to the brain as well. And speech therapy can be helpful in treating individuals and their families who are experiencing aphasia to help with overall communication and life participation and, of course, quality of life. And we kind of learned that although aphasia is not talked about very much, it is very common. So please be aware that it is normal if, as a result of a brain tumor, for instance, or stroke, someone has difficulty with their language. That's actually quite common, and that you may come across someone, whether it's in the community or, anywhere really, that if they're having difficulty with communicating, it's possible they have aphasia, and regardless, there's things that you can do as a communication partner as well to kind of help support that individual. So thank you guys so much for tuning in. Please, see this slide here for some resources. These are some websites that I think are helpful. There is also an aphasia chat group, an aphasia support group located at Carolina's Rehab at the main campus, and this is open to patients and caregivers. I have the information there. And this is not just for individuals who have aphasia from cancer. It can be aphasia from all the different reasons that we discussed in this presentation. So definitely check that out. And I also included my information here as well. Feel free to reach out for more information or ask your oncologist for a referral to our clinic here. Thank you so much.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.